Good morning, dear friends. So, yesterday we have seen the lumbosacral triangle of Marsali, and today we are going to discuss another triangle of our body called as Inguinal Triangle. It is also called as Hesselbach's triangle. So, let us discuss about this Hesselbach's triangle. So, before explore this, please subscribe to my channel. So, what is this inguinal triangle? So, inguinal triangle is situated deep to the posterior wall of inguinal canal. Hence, it is seen on the inner aspect of the lower part of anterior abdominal wall. So, when you just separate all the abdominal wall muscles from the inside, we can identify this triangle called as inguinal triangle or Hesselbach's triangle. Let us see the boundaries of it. So, here we have just separated the anterior abdominal wall above and we have lifted it up, and from the inner aspect we can identify the rectus abdominis muscle fibers. So here there are vertical muscle fibers, they are called as rectus abdominis muscle fibers, and here you can identify the inferior epigastric artery. Okay, let us discuss about the boundaries of it. So the boundaries of the inguinal triangle are the medial boundary, lateral boundary, base and apex. So let us discuss about this triangle. So the medial boundary is formed by lateral border of rectus abdominis muscle fibers, and lateral boundary is formed by inferior epigastric artery, and the base is formed by the medial half of the inguinal ligament, which is extending from anterior superior spine to the pubic tubercle. That is inguinal ligament. The medial half of the inguinal ligament is forming the base of the Hesselbach's triangle, and the floor of the triangle is covered by the peritoneum, extraperitoneal tissue, and the fascia transversalis. So here we are observing from outside. Let us see from inside. So in this picture you can identify we are observing from inside. So we have separated the anterior abdominal wall muscles at the upper part, and we have lifted it up, and we can identify from inside. This is nothing but the rectus abdominis muscle fibers, and here you can identify the fascia transversalis, and below that you can identify extraperitoneal connective tissue that is lined by the loose areolar tissue, that is extraperitoneal connective tissue. So these structures which we can identify from the inside. So we need to understand the boundaries of the Hesselbach's triangle. So medial boundary is formed by the lateral border of rectus abdominis, and lateral boundary is formed by the inferior epigastric artery, and the base is formed by the medial half of inguinal ligament. So in this picture we can identify clearly the boundaries. This is nothing but the medial boundary, and this is inferior epigastric artery forming the lateral boundary, and the apex is joining of the medial and lateral boundaries. The base is formed by the medial half of the inguinal ligament. And here you need to understand two separate areas in the Hesselbach's triangle. One is lateral area, another one is medial area. So how this Hesselbach's triangle is separated into two areas is by medial umbilical fold. So this medial umbilical fold, which has been formed by obliterated umbilical artery. So if the hernia during inguinal hernias, direct inguinal hernias, the herniated sac enters into the scrotal sac through this Hesselbach's triangle, that is called as direct inguinal hernia. If it enters into the deep inguinal ring and comes outside through the superficial inguinal ring and enters into the scrotum, that is called as indirect inguinal hernia. So in this picture you can identify clearly this is nothing but the indirect inguinal hernia. So here you can identify the hernial contents, they are passing through the deep inguinal ring and enters into the inguinal canal, and it is coming out through the superficial inguinal ring. So this type of hernia is called as indirect inguinal hernia. And in this picture you can identify clearly how the direct and indirect inguinal hernias are going to happen. So in the first picture you can identify the herniated contents, they are entering into the scrotal sac through this Hesselbach's triangle. So that is about the direct hernia. Indirect inguinal hernia, it is coming through this deep inguinal ring and enters into the superficial inguinal ring and reaches to the scrotal sac. So this is nothing but the indirect inguinal hernia or oblique hernia.